I had the pleasure of speaking about ALS at the recent American Academy of Neurology meetings. For me, the Academy means a great deal because it was begun in 1948 by Russel N. DeJong, who at that time was a member of the faculty at the University of Michigan, and 3 other neurologists. And I am the Russel N. DeJong Professor of Neurology here at Michigan. The academy that Dr. DeJong and his 3 colleagues discovered and developed now consists of 36,000 neurologists and neuroscientists. This year, the meeting was virtual. And again, I spoke on ALS. And what I discussed was the importance of inflammation and the immune system in ALS. Now, the immune system is something that's important to help us fight off infection. But in ALS, what appears to happen is the immune system becomes dysregulated and it actually attacks nerve cells. And what we have shown in our laboratory is that specific immune cells are particularly dysregulated and have honed in to attack nerve cells. And what we can do in the laboratory is block that attack with specific drugs. And it's this class of drugs that we hope to repurpose in our patients with ALS. I was also accompanied by my colleague, Dr. Stephen Goutman, and he spoke on the environment.
Hi, my name is Stephen Goutman, and in combination with Dr. Eva Feldman, I had the pleasure of addressing the American Academy of Neurology meeting this year, 2021, on the topic of amyotrophic lateral sclerosis, or ALS. I was able to discuss with the Academy members the presentation and the diagnosis of ALS to give a background of this topic that we find so important. And in addition, I was able to share our work and our knowledge of environmental risk factors for ALS. ALS is a disease caused by both genetic and non-genetic causes, and it's really important that we gain a greater appreciation and understanding of some of these non-genetic risks so that we can better understand what's causing ALS. And once we find out what's causing ALS, how do we reduce the likelihood of some of these exposures to decrease the likelihood that someone develops ALS, and then really ultimately prevent people from getting ALS. So what are some of the current exposures that we believe increases the risk of people getting ALS? These are things such as exposure to lead, exposure to industrial solvents, exposures to pesticides. In fact, in our own work, we've shown that exposure to persistent organic pollutants, or these legacy chemicals that build up in the environment, are seen in higher amounts in individuals with ALS. And in fact, when we look at these chemicals in individuals with ALS, those that have higher amounts of them in their blood actually tend to die at a faster rate. So I was very fortunate to be able to share some of our knowledge and some of our work with the Academy members. And really, we need to do this to encourage everybody to really begin to appreciate these environmental risk factors for ALS so that we can build larger teams and larger cohorts across the United States and globally so that we really can begin to tackle this problem as a team. Thank you very much.